Why is kidney function monitored when using diuretics for ascites? Imagine trying to drain a pond that's overflowing without causing the surrounding land to dry out. That's similar to what doctors do when they use diuretics to treat ascites. They want to remove excess fluid from the abdomen but need to be careful not to harm the kidneys in the process. Kidney function is closely watched during this treatment because diuretics affect how the kidneys handle sodium and water, which can influence blood flow to the kidneys. If too much fluid is removed too quickly, it can lead to a drop in blood volume, causing the kidneys to receive less blood and oxygen. This can result in kidney hypoperfusion, which means the kidneys aren't getting enough blood to work properly, and in some cases, it can cause acute kidney injury. Patients with liver disease often have already compromised kidney perfusion because their blood flow is altered. Liver problems can activate hormonal systems like the renin-angiotensin-aldosterone system, which tries to hold onto sodium and water to maintain blood pressure. While this helps in some ways, it can also make the kidneys more vulnerable when diuretics are used. These medications, especially aldosterone antagonists like spironolactone, help reduce fluid but can disturb electrolyte balance and kidney function if not carefully managed. Monitoring kidney function helps prevent the development of hepatorenal syndrome, a serious complication where the kidneys suddenly stop working because of worsening liver disease. By regularly checking serum creatinine, blood urea nitrogen, and electrolytes, doctors can see how the kidneys are responding to treatment. If kidney function starts to decline, they can adjust the diuretic dose or switch medications to avoid further damage. Electrolyte imbalances are another concern. Diuretics can cause low potassium or sodium levels, or sometimes high potassium levels, which can affect how the kidneys and heart function. Keeping an eye on urine output and clinical signs of dehydration or fluid overload helps ensure the patient stays balanced. In practice, this means frequent blood tests and careful assessment of how much urine the patient produces and how they feel overall. If kidney function shows signs of stress, the doctor might reduce the diuretic dose or add other treatments to protect the kidneys. The goal is to safely reduce the fluid buildup in the abdomen without causing harm elsewhere. In summary, monitoring kidney function during diuretic therapy for ascites is essential because patients with liver disease have delicate kidney blood flow and are at risk of injury from changes in blood volume and electrolyte levels. Regular checks help doctors tailor treatment, ensuring fluid is removed effectively while keeping the kidneys healthy. Always remember, individual cases vary, so it's important to work closely with healthcare professionals to find the safest approach for each person.